I'm Joycelyn, and I'm proud to be Director of School Programs at It's Time Texas. It's Time Texas is a nonprofit empowering Texans to lead healthier lives and build healthier communities. And we partner with schools and other nonprofits in the fundamental belief that healthy children learn better. We're so proud to be partners with ATPE, and we thank you so much for the time and space to have this discussion. We're proud to be partners with ATPE and their commitment to serve the needs of educators across the state who are teaching and serving children during this very challenging time. A quick reminder, people can send questions and thoughts through the Q&A feature at the bottom of their screen. So let's get started. Schools are transitioning from a virtual environment to face-to-face instruction. And there are new guidelines and procedures. There are new materials and routines. After an unprecedented spring and summer, educators are coming back into their school buildings and adjusting to this new COVID-19 environment. We're hearing stories about educator health and mental health, and there are concerns and there is worry. How do we stay healthy physically and mentally in this time of change and stress? I'm excited to welcome 3 guests today who can offer up strategies and resources to empower educators towards health and wellness in this time. Panelists, I invite you to introduce yourself with your name, your affiliation, and what health concerns you're hearing from educators about and within the arena of education. Actually, before we get started, we've been joined by our ATPE connection. Joy. Joy, so good to see you today. Did you want to share anything before we get started with our panelists?
Yes, I would love to. I just wanted to briefly mention how very happy I am to Texas joining us again to offer this webinar to our members, of course, with fall approaching and contend with this year as we normally do, but COVID as well. I think we're all very excited to hear some tips for staying healthy. And as always, we truly appreciate our partnership with It's Time Texas.
Thank you so much, Joy. We're really excited to be here, and we're really excited to hear the viewpoints of our panelists. So coming back to our work here today and to talk about staying well and healthy, I'd love for our panelists to go introduce ourselves. We'll start with Arlette and then go to Amber and Karen. What are you hearing from educators about and within the arena of education? What are you hearing about health and wellness and mental health? And what does that bring up for you? Arlette, do you want to get us started?
Yeah, definitely. Thank you so much to everyone for being here. Thank you to ATPE, and thank you, Joycelyn, for being our moderator today. So as my username here says, my name is Arlette Polak. I am with It's Time Texas, and I am one of the program coordinators. As Joycelyn mentioned earlier, It's Time focuses a lot on supporting behavior change support, empowering communities, and just providing them with the tools to lead healthier lives and the healthiest life that they're able to reach. So in conversations with school staff, from superintendents to wellness coordinators, I keep hearing this theme of wanting to develop strategies around resilience and self-care, and I think those are very common trends right now. So I'm excited to be in this chat and talk about ways to support those and just building the resiliency toolkit of our educators.
Great, thank you so much. What about you, Amber? What are you hearing and what does that bring up for you?
I'm in a high school, and my high school teachers, I'm a school nurse in a high school in the Dallas area, by the way. A lot of my teachers are they're worried and concerned about getting COVID and what that means for them, and then taking that back to their families. That's a lot of the worryiness that I see. I share with them strategies that I do on my own. Like, I take my shoes off at the door. I take my scrubs off before I go into my house, like in the garage, and then take a shower before I hug my family. Little things like that, and that's what I share with them.
What about you, Karen? What are you hearing, and what does that bring up for you?
It must be the nurse in us, Amber, because
Oh,
I know I preach the same information. But much like Arlette said as well, I think that self-care is so important. I'm a nurse administrator in a relatively smaller school district in Central Texas, as well as the president-elect for the Texas School Nurse Organization. And across the state of Texas, we have various means of returning to school. For instance, I've been in school, this is our 6th week. We started back in remote and face-to-face the end of August. Some districts in my area have started sooner than that, and other districts across the state have started later. So depending on where you're at with that start, I think depends a lot on how the anxiety level is among the students and staff and parents about returning to school. I would say our first weeks were much more challenging with that. As we've gone along, I think we're learning more and we're practicing a lot more as well, keeping distances and taking care of ourselves.
Thank you so much, Karen. I appreciate that perspective that you bring and what you said about learning more. I really want to dig into that, especially as you started, as you shared with me before we started a little bit earlier than some school districts. And so getting into some of those stories and those lessons learned. So I'm going through my notes, excuse me. So COVID-19, impending cold and flu season, and then just job changes because of those two things. That's a lot to manage. How can educators care for them at this time? And just kind of going deeper into what you overviewed for us in your introduction. So we'll take the same lab, Arlette, Amber, and then Karen. What are your perspectives on what we can do to take care of ourselves as educators? And Arlette, you mentioned resilience and self-care. Could you go a little deeper and talk about what that could look like and sound like for an educator?
Yeah, I want to be really cautious about using the word self-care. I think it's got this branding that's been attached to it, and I've heard educators and nurses just mention that they're kind of sick of that word. So call it what you may, taking care of yourself, being mindful, being present in yourself. Just take it for what is meaningful to you. In regards to like the mental health and self-care perspective, I think it's really important to understand that you're going to be well as long as there's people to support you and people around you, as long as you're making that effort to connect with other people who are maybe kind of going through the same things that you are. So maybe focusing a lot on developing your self-efficacy around taking care of yourself through mental health, and that can be done through a variety of ways. Mental health has such a stigma oftentimes. It's almost like people are a bit scared to say that they need help with their mental, and I think that's something that we need to normalize and just make it something that's normal for everybody to kind of take on. So those are really important things to focus on, and just understanding that you need to find your motivation for taking care of yourself. We talk a lot about how teachers are dealing with a lot right now. They're being pulled in multiple different ways, and it might be overwhelming to even think about taking care of yourself mentally because you're focusing on taking care of everybody else. But you need to prioritize that intent. It's all right if you're not able to get started right away with, Amber was talking about strategies like taking your shoes off and really unpacking from the day. Those to Amber and to Karen and to myself might be easy to do, but everybody kind of starts at their own point. And just finding those self-care habits that you'll be able to commit to. I also think it's really important to find an accountability partner, whether that is your coworker or your partner or your child. It's really important to kind of have that, again, like I was mentioning earlier, that social connection that really promotes sticking to those habits that you're wanting to develop. I also think it's really important to identify your why if you're wanting to take care of your mental health, if you're wanting to engage in more self-care. Identifying your why is going to be your constant source of motivation. So when things get difficult, you can always kind of tie back into that motivation to your why and kind of continue moving forward. I don't know if anybody has any thoughts about that in regards to building behaviors around self-care.
Yeah, well, if you have questions, please submit them through the Q&A. And I like what you talked about, Arlette. Find what you can commit to. And maybe it's not the word self-care, maybe it's another word, but what is that intent behind it? I know in my life, sometimes, yeah, sometimes self-care can feel overwhelming, but I've recently liked the word joy. So finding your joy, I've heard it said, and that kind of resonates with me.
I
And the
love
second
that.
thing you talked about was making a connection to someone to share that intent or that joy or that self-care habit too, and then identifying why that brings you joy. So I really like what you outlined. Again, I'd be interested if people that are joining us have some questions about that. And Amber and Karen, if you want to reflect on what Arlette said too, I invite you to do so. So thank you, Arlette, for sharing some of those perspectives around self-care, which is a term I'm going to use today. But Amber, what about your thoughts on some strategies that we can take? You shared a little bit about your procedures, so I'd love if it's more tips and procedures around that way, or if there's something more or different you want to share with the group.
Totally. I mean, there's so many different little things that you can do yourself if you're really worried about catching any organism, right? Whether it be flu or whether it be COVID or just the general tummy ache.
Mm-hmm.
We've all heard about wiping down our frequently touched objects like our cell phones and, do that. But one thing I've thought about is, we wash our dishes every day, right? But how often do we wash our toothbrushes? Think about it. You're putting your toothbrush in your mouth twice a day, maybe, hopefully twice a day. I know some people don't, but you may want to switch that out, especially if you've gotten sick recently. Like, switch that toothbrush out. I know I have a friend that switches it out every month. I mean, that's a little drastic, but hey, keeps the toothbrush industry going. So just little things like that. Just, start thinking about ways. I have another friend that doesn't eat things by their hands anymore. They use forks or spoons. Like popcorn, they use a spoon because even though they wash their hands, they're still just a little tiny afraid that maybe they may get sick. I don't know. But you just got to try to find ways to incorporate safe practices. That's what I would say.
Great.
Yeah.
I appreciate you doing that. And what it really shows me is to be more mindful about the tools that we use every day. You were talking about your toothbrush, or like how can the use of other tools maybe help manage some of the anxiety that we might feel, some of the worry we might have, or
maybe disconnect from the world, from the internet or whatever, an hour before bedtime so you can get some restful sleep, because we all need sleep, right?
Mm-hmm.
And really, to be healthy, you need at least 8 hours of sleep. So those are just some of my thoughts. Karen, do you have anything?
Yeah, Karen, we'd love to hear from you on some of these helpful ideas and tidbits on staying healthy physically at school.
So I have been preaching and harping my 3 W's, which are washing your hands or using hand sanitizer when you can't wash your hands. Wearing your mask and our face covering. If you're wearing a face shield, you really need to be wearing a mask in addition to that to minimize the transmission of the germ spread. And then also to watch your distance. And I think for classroom teachers and staff, and school staff, keeping that 6 foot from others is really essential. As we've been finding some of our students that have tested positive, we have had to quarantine students and staff in different classrooms and on different athletic teams and extracurricular activities. And the key question is, were you able to maintain a 6 foot distance for 15 minutes or more? And if you can answer that question and say yes, then you don't have to quarantine. But if you have put yourself in the circumstance of being less than 6 feet, And I do understand across the state that this varies by county rules and regulations, but typically it's less than 6 feet. For us, it's with or without a mask. Then if you've not maintained that distance for 15 minutes or more cumulatively, then you're at risk for being quarantined. So I really like Arletta's adding another W to that and finding the why. Why is it we do what you do? Making time for yourself, whether you call that self-care or relaxation or exercise or whatever it is that you do that is able to release for you. It may be to meditate, it may be to read. Making time and finding that balance with what we're doing at school to help students every day and what we're doing for ourselves. Eating well comes to mind. I mean, it's so easy to, now that the restaurants are all back open and we want to support our local restaurants, it's easy to drive through and pick it up. And that's great occasionally, but not necessarily every day. We may want to look at what it is that we're consuming.
Right. Also, on the thing about the masks, Karen, don't reuse the same mask over every day. You need to get a fresh one, just for cleanliness. Don't you?
Is there a specific brand, Amber, that you would recommend? Because I have one called like Blue Bear, and I've seen it a lot. Maybe I'm getting targeted messaging, but I keep seeing Blue Bear around. So is there like a specific one that you would recommend over another?
I would recommend a 3-ply or thicker mask. N95, of course, is the best, but those are hard to come by.
Yeah.
I don't recommend the gaiters, those little things that you put over your, they go around the neck.
Yeah, I've seen those.
They're too thin. They're
Too thin. Okay. What are your opinions on the masks that are covered, but then they have like a hole with the filter here? Not good?
No, they're not good either.
Okay, good to know.
The thought behind the filter is that it may be filtering what's coming in, but it's not filtering what's going out. So you can still be potentially spreading droplets through that filter. So we pretty much look at the CDC guidelines for those recommendations.
Yeah. This is great. Really, really helpful. Karen, the 3 W's, love them. Might make a sign for my own home to remind myself. But has that campaign, is that like something that you ascribe to yourself, or is that something that you've seen or that you've implemented at your school or in your school district or seen at schools?
I'm not sure that I really invented it. It's out there. There's some people have 5 W's, some people have 4, some have 6. I just happen to like those 3 main ones because it's quick and simple to be able to particularly teach students, but also to remind staff. And as I mentioned, probably the most important of those with our staff has been to watch your distance. We've had so many staff that have had to be quarantined as a result of an exposure, and had they really kept that distance from their students or from each other, and when you're in the workroom or when you're at the copy machine or at the mailboxes, in the lunchroom has been classic because in the lunchroom we take our masks off. So we don't have the protection of the mask or the face shield when we're in the lunchroom. So that 6 feet is especially important in those locations. Again, to prevent this spread of the virus. And then if you're staying healthy, you're obviously going to have a better mental health picture of what self-care, well, I know you wish you knew self-care, but I still like that word. Taking care of yourself is all about if you're able to maintain COVID-free.
Yeah, I appreciate that. So often when we think of schools, we think of the classroom. And you know, school is a whole environment, a whole ecosystem. It's several places where you not only sit and learn, but are up and learning and doing different activities with, like Amber said, with different tools. Not just as a student, but as a teacher, it requires different spaces for you to be in order to get the tools you need to do the work you've been asked to do, the very important work of teaching, so or educating, or however that looks in your school environment. So I appreciate kind of going slow and thinking about every space, thinking how you enter that space, and being mindful of your space when you're there. And Karen, I appreciate you saying that watching your space is one of the key, key levers of being healthy, which can be hard um, when students need your help. Like if somebody says help, you go to them. And so like it's very natural. So to think that you have to change your response when that stimulus is presented of I need help or I have a question is challenging, but not impossible. But requires a mindfulness, and then because you're putting so much effort into changing those procedures of your craft, where is the time to, I love the words that you used, to relax, to find balance, to eat well, to meditate, joy, to all those things that allow you to refuel yourself.
I also think it's really important to highlight the need for like self-advocacy. If you're feeling uncomfortable in a certain place and you can remove yourself, feeling totally okay with doing that, or requesting your coworker to maybe take a couple steps back, and knowing that you're doing that for your safety and also for their safety ultimately. So creating that norm and just creating that that sort of trigger in your head to if you're feeling like you're being invaded, it's totally okay to self-advocate there and request what you need in that moment. And hopefully, teachers feel that in regards to their admin, to their administrators, to their supervisory staff. Can you advocate for yourself to them and request, policy changes or changes in environmental structures, like making sure that there aren't closed doors, that there's ventilation in the rooms, things like that.
Thanks, Arlette. That's a good point. Part of being safe is also feeling safe enough to ask for what you need. And I appreciate you reminding us of that advocacy we can do. One thing that you said, Karen, that I did want to dig deeper into is the lessons learned. You shared that you started on the first day that I believe was planned for the district, and I'd love to hear what kind of lessons you've learned in these first couple of weeks and how the practice is changing. I think that's a story of resilience that we talked about, of how a school and how an environment can change to meet the needs and can learn.
Well, for so many of us in our district, it was just a matter of really missing children. I mean, our whole philosophy of our life and working in education and school nursing or teachers is to be with kids. And we spent enough time in the spring with remote learning. And although that's a great option for those families that choose, it has also been wonderful to be able to bring our children back to school. But with that came a lot of preparation and planning. I mean, months of preparation in thinking about seating charts, particularly at secondary level. We don't always have seating charts at secondary. And so thinking about seating charts so that in the event of having to have a positive exposure, we wouldn't have to quarantine the entire class. We would only look at those students that were adjacent to the person who tested positive. Looking at who they sit with in the lunchroom. Again, I mentioned the lunchroom, particularly because that's where they are without their mask. And if they're in physical education or athletics or playing an instrument or singing in the choir, what are our plans for how we're going to be able to social distance all of those events? And so a lot of planning went in, and of course we change things all the time. The way we started back at the end of August isn't necessarily the same way we're doing things now, but we are learning from ways that we can continue to improve that social distancing, whether that be on the bus, in the pickup line, in the classroom as students arrive, just investigating and exploring our best avenues. And I think the greatest thing for me was the fear of coming back to school. The students were anxious, of course. They want to be there. You know, kids are resilient. They want to be there. And they were really okay with even wearing masks. We were concerned about that, but we are adults and they are children, and they did fine with it, as did we. We all learned that, yes, we can continue to nurse and to teach with some type of a face covering. So those are all ways that we've adjusted to those weeks of being in school. That fear from the very beginning has really decreased as we've gone through. Not that we're not being as cautious as we've always been, because we are. But right from the very beginning, I think we were all just very concerned about what it was going to look like for us to come into school with all these rules and all this guidance. And in fact, the preparation helped, and we have been able to conduct class. And yes, we've had a few cases here and there. Knock on wood, we haven't had any cases transmitted at school, and that's always been our goal. So we hope that continues.
That's really great. And thank you for sharing your story of how you entered in the space. I really appreciate how you said there was fear even when you started, but that the preparation paid off, and that you said that we're still changing things all the time. I think in my head, like, you know, school looks like this, and it has to be static, but it's actually really dynamic. And when I worked in a school, I saw how quickly things could change for a large school district and for small ones too. And so it's important to me to have that mindset of like, things are changing all the time. Kids are resilient. I can be resilient too. And just, having faith in that, because it's how things work. Things are dynamic and changing all the time. And that's a good thing. And that's the way that the operation should run. I wanted to take some questions from the audience, and we do have some. Please keep submitting if you have questions or if you want to comment or clarify on things that the panelists have said or that you're thinking about in your own practice or school setting. One question, and this is probably for our nurses, Karen and Amber: should temperatures be taken before entering the building? Does anybody want to, Karen or Amber, address that one?
I will say I don't think that that's very time efficient, because temperatures fluctuate. Parents can dose a kid with Tylenol and send them on their way, so you're not going to get an accurate reading. And it really doesn't reflect illness, at least with COVID, because you can have COVID and not have a fever. Karen, do you want to say anything else to that?
Yeah. Across the state, obviously, our big state of Texas, we have various policies and procedures in place depending on the local decisions.
Exactly.
We've not had a lot of direct guidance from the Department of State Health Services or from the Texas Education Agency when it comes to school nurse practice in particular. So each organization, each district is providing guidance for their individual schools. And some are screening students on the bus. Some have arranged to have bus drivers do temperature screening before the student even comes to school. Others are screening as they walk in the front door. As Amber mentioned, fever is not really, it is one of the symptoms of COVID. But with my experience with the students that have tested positive, it's not an automatic or routine type of expectation. We don't see fever as much as we see some other of the symptoms, such as cough, fatigue, loss of taste or smell. A fever can be associated there, but we oftentimes are seeing fever in relationship to other illnesses as well this time of the year. So I don't want to say it's not valuable, because for those nurses that are doing it, they're obviously finding some value in that, and hopefully they're collecting the data that they're creating from taking those routine temperatures to be able to justify whether to continue it or whether to discontinue it.
Right, that's really helpful. Um, yeah, I think you hear a lot of different ideas. What would you
I say
say,
it
Amber?
depends.
Yeah,
It depends on where you are.
yeah.
I also think about having to screen every single kid coming in, their temperature, the workflow for that, how overwhelming it might be, not just for the people administering it, but also for the kids themselves. Maybe giving them some sense of normalcy, you know, with not having to take their temperature whenever they enter into certain rooms. But again, I'm not a nurse.
Well, then,
Yeah.
so what about the student who does have 100 when you're screening them? Then what do you do with them? If they're screening on the bus, is there going to be somebody for them if they go back home? Or do we still then bring them to school and put them in a separate area? Or do we somehow confidentially escort them to the nurse's office rather than send them to class? I mean, there's a lot of issues with that, which I'm sure those that are doing screening have managed to figure that out. But there are, again, that's where that pre-planning would really come into play.
Right.
Yeah, the level of responsibility of the school to take care of that kid after knowing that they have a 100-degree temperature. Yeah, that's true.
Yeah, I think one of the best things we would say back to that person that is asking the question is to ask more questions. How are you understanding how that procedure works and what does happen with once somebody's identified as having a fever, staff or student? What kind of support do they receive so that that information is acted upon responsibly? It's a really good question, and I know that, like you said, Karen, those are very local decisions, and whether or not they do it is important to the administrator that is making those decisions and rolling out that procedure. But it is an opportunity to be more informed as a staff member and to understand what's going on and what is important for the procedures in the given school or the given district. So it's really helpful to extrapolate that, to unpack what that question is, and know that we all have a stake in the health of our students wherever we fall in that procedure. A second question we got is there any research or any thoughts about what will happen to our hands with the use of a lot of hand sanitizer?
We're all going to have wrinkles. It's going to look like we're all 90 years old. Not that there's anything wrong with that.
No. Has that come up for you as nurses around like the overuse or potential long-term effects of hand sanitizer?
I'm not aware of any studies per se. I would have to do my research actually. I know I'm using a lot of hand sanitizer, but I still much prefer my 20 seconds with bubbly soap and warm water. So whenever you can find a balance of that, I think it's great. When you can't wash your hands, hand sanitizer, you know, with the 60 to 70% alcohol is best for killing those germs. It is going to dry the skin as well. So maybe that's one of those things that you do in the evening before you go to bed, is make sure that you're keeping some lotion or some oils on your skin to be able to rehydrate it.
And that goes back to your self-care.
Absolutely.
That would be a good strategy to include, massaging our hands right before bed with some essential oils and creams. Yeah, I love that.
And be sure you're drinking enough, because our skin is really dependent on how hydrated we are. And I find that when I'm wearing my mask, I don't drink as much. Even during this presentation, I've been sucking down this big old cup of water, because when I'm masked, I don't have a way to really be able to do that. So making conscious effort to be able to keep hydrated with water is important.
Yeah. You know, I had a thought as you were talking about, like, do I believe that drinking water is self-care? And like, can I invite myself to do that? Can I honor that I've taken care of myself because I've done that action? And, you know, one of my thoughts around, like, it's a lot. It's a lot. And it feels like it can be overwhelming quickly to think like of all the procedures involved. But if you add drinking water, like, that is actually for yourself. And that is a self-care procedure you can add in that is another procedure, but that one's for you. So
I love that. I think drinking
yeah,
water is so important. You're nurturing your body with what it needs to continue running smoothly throughout the day. You're taking a pause, and you can even take it a step further and be mindful when you do drink your water. Like, how does it feel in your body? Do you feel it in your chest? Do you feel it in your belly? Like, being mindful when you're doing it. I think it's a great self-care technique, especially if you're adding in mindfulness.
yeah, yeah. So all those connections that we can, that doesn't have to be like the emotional labor of something else, but could be actually the joy of taking something for yourself. Um, so we have these questions are rolling in, folks, and I appreciate it. Keep them coming. What advice do you have for schools wanting to start small group instruction and or meet with students potentially from various classes and grade levels? What do you do if they will not have the physical space to maintain 6-foot distance for that 15 minutes or more of instructional time? So we're talking about small group instruction from various classes and grade levels. Starting that, and it's a small group, but they won't have the physical space distance for that extended amount of time. Are there ways to mitigate that?
That's actually one of the mitigation pieces, is to keep students in pods or in teams, or however you want to refer to it, in a classroom, especially as we know, we can't just add classrooms to be able to add more students because of the space that they need. And I know there was a statistic that was done with one of our schools, one of our larger elementary schools, that if we really kept everyone 6 feet apart, we'd only be able to bring back a third of the students. So we have to be creative with that. And one way of doing that is to keep students in these teams or families. Some are calling them families, because it's almost as if it's the people that you live with. It's not the people you live with at home, but it's the people that you spend your time with at school. So you're working in groups with them, you're eating with that same group. At recess, you may be participating in the same activities, using the same balls or the same hula hoops, or so that there's a minimal amount of touch and exposure to secretions or respiratory issues. And then in the event of needing to quarantine because of an exposure, you're only looking at quarantining the team and not the entire class or grade level. So there is some thought to that, and there is some research, and I believe the CDC has a reference on that. It was reopening K through 12, and it actually talks about those smaller groups and the effectiveness that can bring to a school.
Great. I appreciate the response. I appreciate the question. If if for some reason somebody would like to clarify the question or say what about small groups in this situation, please feel free to. I know that it can be, I have thought through a procedure and been but what if? And so this is totally a space where you can ask your specific question. Another question that has come up is, have you observed a difference in the number of COVID-19 cases in districts that are screening for daily symptoms? So a difference between these two cases. One, screening students for symptoms on a daily basis, whether that's asking questions or temperature checks, versus those who are leaving the screening to parents or on an honor system. And I wonder if you have those two different types happening within your district.
No, we screen as the kids come in, so I can't answer that question.
Mm-hmm.
I haven't heard from anybody else in the state. Other nurses, Karen, have you heard of other nurses from across the state?
Again, I think it varies by district.
Yeah.
It's an expectation for us that parents are screening their children. We're just asking that they report to us if they have any symptoms or have fever. So I think it varies. And again, with this being a new virus, this will be new data for us to be able to collect, and hopefully at some point be able to compare when this pandemic hit, what was the best practices that school nurses were able to develop in recognizing those students with COVID and how to prevent that.
Yeah, I appreciate the question. It sounds like which is interesting. Karen, your district seems to be using the honor system, and then Amber, your district seems to be using the checking for symptoms.
Exactly.
And I think
The data is just not there
the
yet.
data just isn't there yet in such a small frame of practice. And the districts are just so different.
Right.
There's multiple, like, more differences, I think, than sameness in terms, or no, I think there's still sameness, but there are a lot of details to factor in terms of variables. And so I think that question is to be determined. But I think it's a great question to see what comes forward from the data this year.
And there's some districts that aren't even in school yet. So
yeah.
they're all still, there are many that are still teaching only remote and have not introduced the face-to-face option. So it will be interesting. I just hope all the districts are collecting that data and that information so that we can learn from it and grow. Not that we'll ever have to do this again. I hope not, but learn from our experiences for sure.
Absolutely. And I think these questions, sometimes I tell myself, like, I have this question, and is it a curious question or is it a question that I need to make a decision? And I think there are a lot of curious questions I have around COVID-19 and the virus and temperature taking and procedures and hand sanitizer and hand washing that I think would be interesting to know. But is it really helpful for me to make the right decision to actually personally feel safe, feel healthy, feel like I can do the job I need to do? So it's been interesting to kind of grapple with these changes and with the ambiguity of it all, and trying to, like, sometimes it's like, will answering this question actually make me just feel better and feel sane instead of, like, asking so many questions. So I appreciate that this question has no answer, because sometimes that's all you can do, and be like, that question is for later. Another question just came in. When I'm screened at school, it usually reads too cool, like 91 or 92. How helpful are the thermometers?
Do they have another thermometer that they can check with?
It's a good resource.
Yeah.
Check that data, take some averages.
Use a different thermometer.
Have you just come out of an air-conditioned vehicle that the AC has been blowing on your forehead?
Yeah.
Or have you just finished a run and, well, our weather's cooler now, but a week ago, it was 100 degrees outside and you just finished a run, that might affect your temperature as well. So coming into an area, like, maybe stay at room temperature for a while before rechecking.
Yeah.
And then there might be a calibration piece to the thermometer. Each one is different. You really need to evaluate that and check it. But as Amber said, I would probably compare a couple different thermometers just to be sure they're accurate. Make sure the batteries are fresh.
Working, yeah.
Mm-hmm.
So many variables.
There are. Appreciate the answer. And hopefully there's some tools for you to use if you come up with that. One question is, I've heard a lot about not eating lunch in the building. Should we try to eat elsewhere if possible?
Outside is great.
Yeah, that's what I was thinking.
As long as you can maintain that 6-foot distance, any place is fine, but outside is wonderful.
Get fresh air, get some sunshine.
Great.
Self-care.
Healthcare. There you go.
Yeah.
Now, is that in reference to the kids or to the teachers? Like, is that the teacher's lunchtime or is that the student's lunchtime?
It's not specific. Do you have thoughts on either or both?
Well, if the teacher can go outside, or like during their planning period, maybe go outside and take a break, get outside the building, get some fresh air, change your environment, that actually helps you focus better and it's another self-care technique.
That is.
Yeah.
These have been really, really great questions. I really appreciate serendipitously, this is the last question we have. There's a lot of information and misinformation out there. In your opinion, are teachers worrying too much to go back to school? Is it really that risky, or are we over worrying?
Wow, that is a great question.
That is a good question. Arlette, I'm gonna let you go for that one.
Are people worrying too much? I mean, given that it has been named a pandemic, I think that just kind of should give you some clues into the seriousness of it. You know, there are places that are experiencing it less than other places. And hopefully that question isn't coming out of thinking that, like I was mentioning earlier, that maybe you shouldn't advocate for yourself in wanting to make sure that you're safe. Regardless if it's as serious or if not as serious as you can always kind of take care of yourself and make sure that you're safe in these spaces. So I don't have any citable resources right now on hand. I would have to look up those articles, but based on evidence from multiple platforms, from the CDC to a variety of different ones, I don't think it's being taken out of consideration. I think it's a natural human tendency as well to worry, and it's because we have people we care about around us, and that just adds to I think the need for worry. And hopefully also worry doesn't have a negative connotation. It's maybe being aware and careful and cautious.
Thanks, Arlette.
You're welcome.
Amber or Karen, I'd love to hear your thoughts on, like, are we worrying too much, or is there a right way to worry and place those worries from your perspective and practice as a professional?
Worry is one of those W's that can really affect whether or not you can practice effectively and appropriately. Too much worry, yes, definitely can cause you to be fearful and anxious. Not enough worry could cause some carelessness and possibly result in illness. So finding, I hate to use that word balance again, but really and truly finding a good place with that worry. I have to say I was worried about going back to school, not so much for myself, but I was concerned about the potential for sharing the virus amongst our students and our staff, and then taking it home to parents as well. So that was very much a concern of mine. And again, being able to take care of yourself, take care of your staff, taking care of your students, being able to educate and explain to them the importance of the very simple things like washing your hands and keeping your distance and wearing your mask and wearing it properly. Those are all very important pieces that if educated properly and if practiced properly, we will hopefully have less worry.
Right.
I appreciate
Find a
that.
happy middle.
Yeah, and it kind of, I love how you took it back to those baseline or base camp ideas that we can follow, right? Like, if you are doing these things, wearing your mask, washing your hands, keeping your distance, understanding why, finding your joy, your balance, however you describe how you fill yourself to be able to do the work every day, then a little bit of worry is normal. We are in a pandemic. It's not necessarily going to go away, but if that worry is impeding your ability to do your work, to be safe for yourself, then that's a time to seek some help and to remember the baselines. And if you feel like you can't meet one, then who in your network, who can you trust to talk that out and find what it is you need to do to advocate for yourself. I'm going to close. There was one question that came through. It's been a big question, so we'll do our best. Maybe we'll limit our time to maybe like 1 minute each, or 1 to 2 minutes each. Should school COVID guidelines closely follow the CDC, TEA, and local health department? What are your thoughts on schools following critical infrastructure guidelines and letting staff work if exposed or asymptomatic?
follow the county first, because that's the local. That's what we do here. And I think, Karen, you're following your local health department. That's, because you're living in a county. So follow your local first, and then the TEA, and then the CDC. One thing I want to ask or say is, if your teachers have questions and worries, maybe they should talk to their school nurse. However, I don't know if all schools have school nurses, but that's another topic for another time. Karen, I'll take it to you. What?
I did want to continue, Jocelyn, with what you're commenting about, with that worry. I want to just go back to that.
No, please, yeah.
Being able to know who to go to and who to talk to if that worry does become more than what you can handle and it exceeds your ability to function, as you mentioned. Knowing what your community resources are and reaching out. Most times your human resources department will be able to help direct you to some type of an employee wellness. Different districts have different extents of that. Larger districts seem to have some more resources in place. Smaller districts may rely on the community resources, but being able to recognize when it's more than you can handle and reaching out when that opportunity arises is key to being able to be successful in continuing your work.
Critical, yes.
Great. Karen, did you have any thoughts on following closely the guidelines? Which guidelines?
So most communities are looking at a positivity rate, and that is the percentage of cases in the community. And based on that positivity rate and the number of cases in each locale will help to direct what guidelines need to be put in place. So to follow up with what Amber said about utilizing your local public health authorities, that really is the essential key to determining how your school will open or how it will continue to be open based on what your school board and what your public health authorities have determined to be safe for your area. Because again, Texas is a big state, and what it looks like in one town might be totally different than what it looks like in a very rural community versus a very urban community. So yeah, local public health is going to be your key, with hopefully that will be based on the guidance that we receive from the Department of State Health Services as well as the CDC.
Great. So we're going to wrap up. You each have 1 minute, and I know the topic of flu shots hasn't come up yet, and we would be remiss if we had our school nurses on site with us and we didn't quickly talk about that as a resource. So if you want to close up, we'll go backwards, Karen, and then Amber and Arlette. If you want to share 1 or 2 more resources or a call to action in a minute, I would really appreciate that. Karen, you want to start us off?
Yes, absolutely. Be sure you take care of you. You have to take care of you before you can care and educate others. So taking care of you would absolutely include obtaining a flu vaccine. Anytime beginning now, a flu vaccine would be very important for you to receive. Not knowing what it's going to look like this fall and winter as we enter flu season, in addition to having COVID present. Heaven forbid we actually obtain both viruses at the same time. So being able to do something about that one, which is our flu. We know we have a vaccine for flu. We don't yet for COVID. So do yourself a favor and do obtain that flu vaccine before we get into flu season.
Great,
Thank
you.
And thank you for all that you do every day for each and every one of our children.
Great. Amber, any parting thoughts?
Just have grace with each other, just even with the parents. Everybody's stressed and everybody has the same worries. Just be mindful of that and give grace to each other. That's
Thank
my
you.
parting thoughts.
Thank you so much. Arlette?
I feel like Karen and Amber really kind of encapsulated what I wanted to say. Also, just striving as hard as you can to find that social connection. I think that's really going to be helpful in carrying you over during these difficult times. And yeah, these are trying times. This is something new for a lot of people. And yeah, giving each other grace. I think Amber put that very well.
Thank you so much. I want to say thank you to our panelists for sharing their time and thoughts with us today, and to ATPE for this space. I learned a lot, and I appreciate all the perspectives you have. Karen and Amber and Arlette shared different resources as well for your support, which were linked in the chat through ATPE, the CDC. Living Healthier, the program that Arlette is about, has free telehealth coaching that can be found at livinghealthier.itstimetexas.org. It's Time Texas is committed to continuing these important discussions of how we unite and impact and transform health in Texas. From now until October 29th, we're hosting weekly sessions through our Healthier Texas Summit, which is free, and you can register at healthiertexassummit.com. And thank you to ATPE for partnering in service to educators in Texas. We deeply honor the work you're doing, and we value who you are and what you bring. Take care of yourselves and be well. Joy?
Yes, I just wanted to say thank you so much to It's Time Texas and to all of our panelists. This was a very interesting and timely discussion for sure. So thank you again so much for joining us this evening. We really appreciate it. Bye, everyone.